Reasons why I pee often. What are the reasons why I urinate often? Good day, everyone, and welcome to my channel. I'm a seasoned and certified medical microbiologist, Gwendolyn Halley, and I'm popularly known as the medical professional with the difference because I bring you knowledge like no other. I bring you health knowledge to your doorstep. I bring you knowledge to the comfort of your living room. If you're a returning subscriber, this is me saying I love you. And if you just stumbled on this video, stumbled on this channel, don't forget to subscribe, like and share, join the family, and I love you too. Let's go there. Looking at 18 reasons why you always pee. 18 reasons why you frequently urinate. I know that we have very busy schedules, but when you find that you're constantly going to the toilet, it's something that you need to sit down, pause, and actually monitor your body so you know where the problem is coming from. And the first of my list is drinking lots of water. Now, if you drink a lot of water, actually, you fill your bladder, and of course, you go to the toilet frequently. And this is good to drink water, but when you drink water excessively, know that you have to sweat a lot and pee a lot. The second point is infections. And when we're talking about infection, we're talking about urinary tract infections. We're talking about chlamydia, we're talking about syphilis, we're talking about gonorrhea. When you have this inflammation around your urinary tract, actually puts pressure on your bladder and actually causes you to go to the toilet when you least expect. In short, more than often. In fact, before you even were supposed to go to the toilet, you find yourself going to pee. So this is very important that you should take note. If you have any burning sensation, any form of pain while urinating, please know that it's a urinary tract infection you have, and that should be treated. Go to see your doctor so you'll be prescribed an antibiotic. The next is small bladder. There are some people who have small bladders and their bladder is not able to contain large volumes of fluid. So what happens is every now and then they find themselves going to the toilet to pass out urine, drinking less water. When you drink a lot of water, you go to the toilet, and also when you drink less water, you go to the toilet as well. When this fluid or urine comes into your bladder and is very concentrated, it tends to irritate your bladder and you tend to go to the toilet even before you should, even when your bladder isn't full. And these irritants could be citric, let me say from you drinking a lot of citrus fruits or juice or fluids, spicy food, caffeine, soda drinks, that means fizzy drinks, also alcohol, and also smoking also can be an irritant to your bladder. So these are some things that irritate your bladder and make you to go to the toilet more often than normal. And the next is weak pelvic floor. Weak pelvic floor normally occurs during pregnancy or after childbirth. And weak pelvic floor muscles, sometimes get weak during childbirth or pregnancy. And sometimes they move out of position. And it will take some exercises, mostly Kegel exercises, some exercises to return it back to its position. And it's very important that women who have given birth or who are pregnant do a lot of exercises to actually work on their pelvic floor muscle. This is very important so that they don't begin to leak while they are pregnant, because it's very common for women who are pregnant to leak. So go for exercises, walk, do a lot of squats in the early stages of your pregnancy, and you'll be okay. The sixth point is overreactive bladder. And this overreactive bladder is a bladder that is very reactive to any form of irritant. And I mentioned some irritants that are fizzy drinks, alcohol, coffee, very sugary drinks, spicy food, and a lot more. These are the ingredients, these are the substances that irritate your bladder and will cause you to go to the toilet more often. The next is medications, and we're talking particularly for those who have high blood pressure and kidney problems. We're talking about diuretic medications. These are medications that are to remove the salt and water from the body. And this is particularly given to people who have high blood pressure, high or hypertension, and kidney problems. So you find yourself, if you're taking any form of diuretic medication, going to the toilet very often because your body is releasing a lot of salt and a lot of water. And the 8th point is diabetes. Those with diabetes go to the toilet very frequently, and this is because the kidney during that time is trying to filter, is overworking itself to filter the blood, and the excess fluid is then sent straight to the bladder. You know, your kidney is very important, and it's trying to maintain your body, keep your body healthy. So that's what happens when you have diabetes. Pregnancy. When you're pregnant, the uterus gets larger because the baby is getting larger, and this puts pressure on the bladder and causes the bladder to begin to pass out urine, contract and relax, and you begin to pass out urine more often than you are supposed to. And even sometimes when your bladder is not full, you find yourself feeling like going to the toilet very often. This is very common in pregnant women. Cold weather. For those who live in cold weather or cold climate, you agree with me that you pee more when it's cold than when it's hotter. And that's because when it's hotter, you pass out a lot of fluids through sweating and through urine. But when it's colder, your pores are closed and you retain more water. That is why you pass out more fluids during the cold weather. So just know that when it's cold, you're going to pass out a lot more fluids. Kidney problem, particularly we are looking at those with kidney stones. What are kidney stones? Kidney stones are when minerals and salt form tiny rocks in the body. And also, this kidney problem, you find yourself passing out a lot of water because your body is trying to work body. So you'll find out that a lot of water will be passed out, will be sent to your bladder during that time. Enlarged prostate. The prostate is responsible for the production of seminal fluid, and seminal fluid is also part of the semen. You know, the sperms produced by the testes, the seminal fluid by the prostate, and when they come together, they form semen. So this is very good. But when the prostate is enlarged, what happens? It puts pressure on the bladder and it causes frequent urination. So that enlarged prostate, because they are around the same area, if you look at the anatomy of a man, puts a lot of pressure on the bladder and you go to the toilet frequently. Now, the 13th point is radiotherapy. If you're going through any form of radiotherapy, trust me, you'll be going to the toilet more often than normal. The 14th point is vaginitis. Vaginitis is when the vagina is inflamed, and this could be caused by microorganisms, bacteria, viruses, fungi, and a lot more. It could also be caused by other chemicals from soaps, from other concoctions that are being introduced into the vagina. And this could cause the vagina to swell. And this swelling of the vagina puts a lot of pressure on the bladder, and the bladder then begins to release urine more often than it should be, even when your bladder isn't full. When you drink too much alcohol and caffeine, you will find the hormone asking your body to instead send water to your kidney or send water into your body that will actually cause the transportation of excess alcohol and caffeine to leave the body through the kidney. The 16th point is menopause. Any woman who is going through menopause will agree with me that they go to the toilet often, they make money more often. That's because of the reduced amount of estrogen in their body. Estrogen is a very, very important hormone in the woman's body, and it's being released and it's being produced at puberty. It helps maintain the woman's reproductive health. So when a woman has low estrogen, she's more prone to going to the toilet more often than normal. It's tumour in an abdomen. If you have a tumor in your abdomen, or any lady who has fibroid, polycystic ovary syndrome, or any form of polyp or growth in their womb, around their pelvic area or abdomen, this is going to put pressure on your bladder, and you find yourself going to the toilet more often, even when your bladder isn't full. The 18th point is constipation. When you are constipated, when your bowels are so full, because the distance between your bowel and your bladder, in fact, they are both they are closely located together. When your bowels get full, they put pressure on the bladder and they force you to pass out urine even when you don't feel like, even when your bladder is not full. That pressure constantly makes you to feel like going to the toilet when you don't feel like. This is what happens, and constipation weakens the pelvic floor muscles. So these are the 18 points of why we frequently urinate, or why we have the urge, or why we frequently pee. So this is going to help you to be able to know what's happening. So looking at all the points I have given, you can know where you fall. So go see your doctor if you notice that you have this urge to constantly go and pee even when your bladder is not full. And when you have this urge to pee, when you go to the toilet, you realize that you pee just a tiny mini 20 mils of urine or 10 mils of urine. So these are things that you need to work on. Make sure you are very sensitive about your reproductive health. Don't ignore certain things. Go and see a urologist. Go and see your gynecologist so that your reproductive health can be preserved and protected. I remain your seasoned medical professional, Gwendolyn Halle. Bye-bye.